Hi guys, Colin from backpain.com here, another video for you today. Today we're going to talk about sciatica nerve pain and nerve gliding, nerve flossing, different techniques to help relieve that sciatica nerve pain. Now, before we start, guys, if you enjoy the channel, enjoy my content, please hit that subscribe button, okay? Let me help you create content for your wants and needs. Of course, don't forget to like and share as well. So, sciatica nerve, picture's going to flash up on the screen there. It comes out of our lumbar lower back region, lumbar vertebra, runs down through the buttocks, under the hamstring, back of the leg, runs back down the calf there into the foot, okay? The underlying cause can be many, many things: direct trauma, herniated discs, muscle imbalances. Can be many, many root causes, but the sciatica nerve pain can be one of the most debilitating things you'll ever experience. I know, I had it myself. It was a nightmare, okay? Walking like a really severely disabled person. It was very, very crippling, affliction at one point, and I used to do nerve glides myself. Now, I will say, if your sciatica nerve pain is from a herniated disc, bulging disc, then go and check out this video. It's going to pop up at the end of the video today. It's a very specific decompression stretch for the disc, which will help relieve sciatica nerve pain. Okay, it's different from what we're going to do today, but if you stay at the end of this video, it will flash up for you guys. Go and check it out, okay? So, nerve gliding. Essentially, this is our sciatica nerve here, okay? And quite often, this is going to be our muscle tissue. So typically, when everything is healthy and your body's working normally the nerve just glides, okay, through the muscle, through the tissue without any problem. However, if you've undergone some sort of trauma, be it herniated discs, direct impact, muscle imbalances, tight muscles, even after the initial trauma has subsided, maybe your herniated discs they're better, you've maybe had an operation even perhaps, you've still got referred sciatica nerve pain. And quite often what will happen is those tissues that were inflamed, that were irritated before, they're still in some sort of spasm. There's maybe adhesions there, scar tissue. So when you go to move, okay, I'm going to pretend my muscle is getting tight on the band here. It's like it doesn't move well. It's got a lot of stiction, okay? And of course, from that, you get referred sciatica nerve pain. So what we can do with nerve glides is actually sort of get that nerve moving again, glide it very carefully, very slowly, so we reduce the adhesions, we can reduce inflammation and bring about relief, okay? That's the theory behind it. Does the theory work in practice? Yes, it does. There's a paper going to flash up on the screen. If you guys are into your scientific research, you can check it out. It's down in the description below, this particular paper. They looked at this particular technique I'm going to show you right now, and it did help reduce sciatica nerve pain in those people that were involved in this study, okay? So let's get into it. So basically what we're going to do, we're on a chair, we're on a table here. We want to first put the nerve into the most relaxed or slack position, okay? So for the sciatica nerve, we're going to be putting this leg back. We're going to say my right leg is my afflicted leg, okay, in this case. Put that leg back behind me. My toes are going to be pointing down, and we put them behind me as well. Upper body, just want to do a natural, I don't want to be slumped forward. Okay, natural upright posture. I'm going to tilt my head, extend my head back, look at the ceiling. And the movement is simply this. We're going to bring the leg forward, extend the knee, bring the toe towards the knee, and then point the foot away, return the leg back to the slack position. Then we're going to bring the head in. We're going to go chin to the chest. And we're going to go rotate the head back. Nice, slow move, not jerky. Okay, head's tilted back. Bring the leg in again. Extend, toe towards the knee. Point the foot. Bring it back to the slack position. And drop the chin to the chest. Extend the head back. Just like that. Okay, no need to get crazy with it. I'm going to show you from this side as well, so you get a full view. Okay, swing around here. So we start in the slack position. Toes back, you see it's pointed there. Okay. And the head, neck, flexion, neck extension, and again extend, toe back, toe pointed, return, and chin down, extension, forward, toe point, and back. Now, as far as repetitions go, I would look to start off with 8 to 10 repetitions, 3 sets, okay? Take your time, so I was going very slow, very controlled there. So 8 to 10 times, I would take a 2-3 minute break, then do it again, 2-3 minute break, and then do it one more time. Take the next day off, measure how your pain feels. Is it better that next day? Is it still the same? Has it got worse? Okay. If it's got worse, maybe want to try 2 of the other ones I'm going to show you in just a few seconds. If it feels a little bit better, no change, I would go up to 15 repetitions, and then I'd probably max out at about 20 repetitions over the course of a week to get there, so every second day, okay? Remember, if there is more increased pain, makes your symptoms worse, stop the exercise, okay? Talk to your physician, your doctor, physiotherapist, and plan the next course of action, all right? But let's have a go with the other 2 sciatica nerve glides. Let's hit it. Okay, time for 2 more nerve glide, nerve flossing techniques to help with your sciatica nerve pain. Now, I would say if you're really suffering from lumbar disc pain, sciatica nerve pain, chronic back pain, go and check out my course. It's going to flash up on the screen down below, www.bashbackpain.com/course. It's a 21-day video course I've created, which takes you through various rehabilitation exercises, daily behavioral modification techniques, different strengthening work for the core, to get you back on the road to recovery if you're a chronic back pain, sciatica nerve pain, lumbar disc pain sufferer, okay? Check it out today, all right? Now, listen, back to these 2 different sciatica nerve pain glides. Some people, the first one, it won't work for you, okay? I'm working with different patients for many years now. It's always good to try different things. Some things work for different people. So this particular one, we're going to do it on the floor. Okay, so we're down here on the floor. And again, we use the right leg. Now, I want to take the affected leg behind the knee. Here, it's nice and relaxed. Okay, and we're just going to extend the leg to start to feel tension. You might feel tension if you've got tight hamstrings. You may feel tension in the hamstrings from the muscle, but then you might start to feel the zing, okay, of the sciatica nerve. Just go to where you feel some tension in the back of here, and then I'm going to take my foot's pointed, and I'm going to bring it towards my knee, okay, and then I'm going to point it, and then towards me. That's all we're going to do. And again, here, the nerve is slack, and I'm pulling it tighter. Slack, tighter, slack, tight, okay? Again, I would do this 8 to 10 times the first time that you do it. Then we take a break, okay, a couple of minutes, and then go up again. Maybe you'll get a little bit further with the leg this time. It's quite normal. And then again, toe towards the knee. 8 to 10 times, do 3 sets. Day 1, take a day off. Day 3, try to go for 15 repetitions. Okay, and try to get some progress from there. Every second day, step up. Say maximum 20 repetitions, you'll be fine. Don't try and force any of these glides, stretches, okay? Don't push past the point of pain, okay? It's always to your maximum. So that's number 2. Number 3, it's just a simple little extension of this one movement, okay? So this time what we're gonna do, here I start with the foot pointed, yeah? We're gonna make it basically one big movement. We're gonna go up, point of tension, bring my toes towards my knees, hold for a second, and then return. Point the foot down. And again, I come up. As I'm straightening my leg, I go to my point of tension, bring the toe towards my knee, hold for a second, and point the foot, relax off the tension and down. And again, up, toe towards the knee, and point and relax off. Again, 8 to 10 times first time you do that. Work up to 20 reps over the course of probably a week, take you to get there, okay? And one of those 3 should, if not all 3, should hopefully start to reduce that sciatica nerve pain, okay? Let me know in the comments how you get on, any questions, whatever, etc. Please hit me up as well. I'll see you next time. Have a great day.